show you how to get a chin up on the aging process. Annabella has a different challenge, so Dr. Mulholland treated her double chin with another approach. Take a look.
I'm 50 years old, and I've put on, lost weight, put on weight, and as a result, I have all this hanging skin, which I really hope to get rid of today.
Annabella, so good to see
nice
you
to
again.
See you.
You're looking well. Today's
Thank
an
you.
exciting day.
Exciting, yes.
Okay, today is the day that we terminate your double chin.
Every time I take a picture, all I see is the hanging skin. So every time I have the camera in my face, I try to, look this way or look up. It really bothers me.
So we're going to take that double chin. We're going to put that face tight in. We're going to melt it. And so we're going to go inside with a little device to heat that fat and tighten the skin. That's called neck tight and the face tight. The face tight will melt that and give you a little firming. Okay? Then we're going to put a little incision behind your ear, and we're just going to do that. Wow. It's going to be the miniest of mini lifts.
I'm a little bit nervous about the procedure, but I'm not scared. I'm okay with it. I'm just hoping for a really good result, which I know will happen. Really excited.
These are the areas where we're going to defat the double chin. It takes about an hour, hour and a half to do, and you should be back to work in about a week. Double chin, but loose skin. So sometimes the double chin is just hanging in there with the fat, and you remove the fat and you're left with turkey skin, which looks worse than a full neck with no loose skin. So if you have that kind of skin, then we usually heat the fat, get some skin tightening, maybe tweak a little skin away behind the ear, so it's melting the fat with heat and ensuring that we tighten the skin with either excisional techniques or the skin tightening itself. That's melting the deep fat up to 40% contraction. No pain, Annabella? Beautiful. Annabelle, good to see you again.
Good to see you.
Haven't seen you in a while. You look great.
Well, thank you so much.
Well, first let me have a look.
Sure.
You have almost a right angle now. So all that loosey-goosey skin, that turkey neck with the chubby fat is gone. You'll continue to get some improvement because the swelling continues to improve over about 6 to 8 months. You're only 6 weeks, 8
That's
weeks.
Right.
Yeah.
So after the surgery, I went home and with a little bit of pain, a little bit of discomfort, not much. Of course, I looked at my face and my neck right away, and I did notice a difference. Of course, I went to the mirror right away to look. And I did love the difference. Thank you so much.
You're glad you did it?
I'm so glad I did it, yes. I would do it again.
Wow. Okay. We heard the audience when you saw the before and after. That's dramatic. So me being, a wuss when it comes to pain, I'm thinking, oh, I would just do procedure number 1. And then I saw the neck lift. I was like, oh, okay, that's very dramatic. What happened there? Why couldn't you use the Belkyra on her?
That's a good question. It's basically she had fat but loose skin. The Belkyra will melt the fat, but then you're left with more loose skin. So I wouldn't even call this a neck lift. It's really a behind the ear tuck with some heating. The heating contributes contraction with the face tight. We hide some skin behind the ear, and literally it's an hour. It's less than a root canal, and you're left with a nice-looking neck.
You took out some skin, right?
Yeah, and so I went under the chin with this face-tight device. When it heats fat, you get internal contraction, so that leads us to less of an invasive procedure. So then we took the little loose skin on the side, and I hide it right behind the ear, where you might, have a little incision to set your ear back if you have outstanding ear. So it's really easily hidden. A woman can lift her hair up. No one sees anything.
How long was her recovery?
Well, with long hair, you can look good because there's almost no bruising in the front. You can look pretty good the next day. And of course, we're in the scarf season, so in the fall and the winter, it's an easy thing to do. But generally, I tell most women take 3-4 days off. Do it on a Wednesday, back to work on a Monday.
Okay. What were the options before you developed this particular procedure?
We had to do external techniques like radio frequency tightening. People have heard of thermage or venous freeze or the forma. And we would heat, and hope the fat would die and the skin would tighten. And we get some improvement, but nothing like these internal techniques. The new injections for tight skin double chins and little minis and heating for loose skin double chins have changed the terrain of a right-angled neck.
There's always something when it comes to technological advances, when it comes to cosmetic surgery. So very cool. What would the cost have been for this?
If you look at the Belkyra, the injection, that works out usually to be about $1,500, where most of these mini necks are going to be double that price, but you get a definitive result, there's no recurrence, and your skin is gone. So the rest of you may sag, and Isaac Newton may win, but your neck looks good.
Your neck looks good forever. Well, what if she gains the weight back? Or...
because the fat is gone, the skin is tight, it will find a new nesting home. So you want to protect the rest of your figure, hang on to the weight you have, or it'll just go somewhere else. Never your high cheekbones, never your lips, always your arms, your butt, or your calves.
Why can't it just go like here?
Yes, yes.
That's what, just right there.
Well, you can do a little coaxing, but it doesn't work.
It doesn't work.
No, it doesn't.
Never works out that way. Okay, thanks to Dr. Mulholland. Everyone in today's audience will be taking home these skincare products and a gift certificate for Spa Medica. No. Let's go to break. We got more coming up. Welcome back to Breakfast Television. It is 7:11. So Jen Valentine has been at the Live Eye this morning, and she is at Spa Medica. So Jen, this is what I want you to do. If Dr. Mulholland is there, I want you to tell him a big thank you for the Latisse. Latisse is something you put on your eyelashes, and it makes them grow. And I was skeptical, and I started using it, and you can't tell now because I have fake eyelashes over top. But if I took off the fake eyelashes, you would see how long my real eyelashes have become because of Latisse. I know you're there looking at a lot of non-invasive procedures, and they just get better every single year.
They really do. You know, Tracy, I'm going to tell Dr. Mulholland that in a minute, but there's lots of things that you can do just to give yourself a fresher look, like a photofacial or microdermabrasion, non-surgical procedures. But we're going to do one today. If you're a little bit queasy, you might want to turn. We're going to turn at one point. But come on over here. Let's talk about it first with Dr. Stephen Mulholland. Tracy Moore wants to thank you for Latisse, for that made her eyelashes grow. That really works.
It really does. Just topical application, 40% longer, 40% thicker. And so you can wake up with that doughy, glowy sort of eyelash.
Oh, very, very pretty. And you always look good. When you have longer eyelashes, it really does make a difference in your appearance.
Yeah, it's a very youthful thing to have long, lush eyelashes, for sure.
The procedure that we're doing today, this is Jane, by the way, a country karaoke singer. We've been chatting. What's your song of choice again?
Guitar's Cadillac by Dwight Yoakam.
We're going to have to get you to sing that on the show sometime. Loves karaoke. Woo! What's the procedure?
We're going to do what's called Face Tight, and it's a little device. This is what it looks like. And as we were talking earlier, this is like ironing your skin. So if you've lost weight or you've lost skin tone and you've exercised, you've dieted, you can't bring that tightness back after babies, after weight loss, just with age. This is like ironing your skin.
We're ironing those wrinkles away.
Exactly right. The internal electrode of Face Tight goes under your skin, so you have to have local anesthetic, like going to a dentist, and then we just go snap, 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 and without any cutting or any scars, you get tighter skin.
Okay, so we're going to turn the camera away when you enter the skin, just so people are a little bit queasy. So look over there, everyone. And what are we setting this to?
We're setting it to a specific temperature, so it constantly heats the temperature safely and effectively. So patients who do this procedure can literally go back to work the next day.
Okay, you know what? Let's take a look at the before and after while you do the entry. So this is a before picture right at the top here, and then right at the bottom, before is at the bottom, obviously, and then the after is right at the top. So this is the results that you can get with this procedure. Okay, you have entered the skin. What are you doing?
So what I'm doing right now is I'm slowly moving. Jane's in no pain. There's local anesthetic. And I'm basically applying heat under the skin. We've spent so many years developing techniques that heat on top of the skin. This is the first device that safely and effectively heats under the skin, which is far more efficient way to tighten. And so I move back across the area, and the heating tightens the collagen, tightens the elastin, the fibers that give our skin youth. And there's no bruising, no downtime. Patients generally go back to work the next day. And one treatment, it's not a series of treatments, a single treatment to bring back skin tightening and skin health. So the face tight's been very, very popular.
One treatment, you can go back to work that day, not very invasive at all. And this is a new procedure that you've been doing for about 11 months now. So what have the results been like over the last 11 months? What have people told you? What have you seen?
Well, it's been great because I'm showing the neck here today, which is very common, but loose skin of the upper arm or of the upper tummy after babies or of the inner thigh or above the knee. Techniques and procedures where in the past, as plastic surgeons, we go, oh, we have nothing for you. Now we can tighten skin.
So you can do this under the arm too?
Yes, that loose, that sort of bat wing skin, you can tighten that. Anywhere where you have loose skin and you're really not interested in a real surgical procedure, this is a great opportunity for tightening under local anesthetic.
And it doesn't hurt?
Jane, what's it?
No, I don't feel anything.
She'll be singing karaoke tonight. We'll see you when we come back. Non-surgical procedures this morning at Spa Medica, Kev.
Because more and more men are opting for plastic surgery, actually, to keep them looking young. So in today's personal story, we follow Albert, a young dad who wanted to change up his looks.
When I'm walking down the street, I feel like people are looking at me. Just this little gall in here that really bothers me whenever I get a glimpse of it. The line on my forehead and the double chin. I know in real life it might not be as bad, but if you take a look at pictures, you can really tell. I'm gonna get rid of it.
Look at you with the fish.
No, put that away.
My dad's gonna be doing a procedure to fix his chin, so he doesn't have the fat sticking out.
I think the day after, you know, taking care of it. The bruising, swelling, things like that. That's, I think, to be expected. Or otherwise, I'm really excited for him, so.
This is an example of how my chin used to be. I'm getting older and I feel that I need a little bit of a change and just to bring my self-esteem a little bit more up. I decided to go see a specialist. He's going to be doing what's called a smart lipo. I know I've heard in the past, oh, it's only women that are doing these kind of things, but I don't think that's right. A lot of men are going through these procedures today to better themselves, to look better, to look younger, to feel better about themselves. So I don't see anything wrong with it. I'm scared, but I'm not going to let that stop me. Hello.
How are you?
Good, how are you?
Good.
You can see Dr. Mulholland for 11.
Perfect. If you just want to have a seat, I'll let him know that you're here.
Thank you. I just want it to be over. I'm okay. Just try not to think about it.
What we're doing today is very common in men, which is treating a double chin. He's got a lot of lines, worry lines, and he's lost a little bit of his under eye fat, so he's starting to look a little tired. Now I'm going to do a little bit under the skin. We're going to freeze the fat. Almost done here, Albert. You're doing beautifully. So I'm going to be melting and removing the fat and tightening the skin under your chin. I'm using a little tiny fiber optic laser here. You can see the red beam, and that's going to be melting the fat and tightening the skin while we do this. So this is so far a lot easier than you thought it would be.
Yeah.
Now we're going to phase 2, which removing some of that melted fat. Okay, Albert, you're doing great. We're almost finished. I'm loving the contour here. You told many people about your procedure?
No, only about them.
Women are more and more forthright about their cosmetic procedures. With men, still very hush-hush, very taboo. Whatever they've achieved, they achieve through hard work and through their own determination and not through some sort of sissy plastic surgery procedure. I'll put a little bit of filler right here to give you a little less tired look. Relax. I'm going to do a little bit of Botox now. Very tiny needle. This Botox gets into the muscle in about 3 hours. Now we're going to do your worry lines at the top of the forehead here. I think you can see already the nice improvement in Albert's neckline. The recovery is pretty quick. There's a little swelling, little bruising. The risks are low, but anytime we use any type of laser light device, there's a risk of irregularity, asymmetry, not having good skin tone and loose skin, or a little burn where there may be excess heat. We have very much a culture of youth and beauty that is particularly focused on women. When I first started over a decade ago, I might see 1 or 2 guys a year. Now, about 20% of my clients are men.
I feel relieved that it's over. So it'll all go with...
You have a boo-boo under here.
Yeah, a little one.
Joining us in studio now is Albert's cosmetic plastic surgeon, Dr. Stephen Mulholland. Thanks for being here.
Thank you very much.
Nice to see you again. How's Albert doing?
He's doing great. His recovery was less than a week, which most guys want to get back to who they are very quickly.
Of course.
Very little pain and discomfort. Guys are very wimpy when it comes to pain and discomfort.
They are more than women?
Oh, absolutely. I
That's
think we're
funny.
genetically hardwired to, take a woolly mammoth's tusk to the abdomen or a shotgun blast to the leg, but don't give me a little flick or a little needle. That's way too much. Where women are more conditioned culturally and certainly as mothers and of children to hair removal and waxing, and they're just subject to more discomfort to look their best. Guys have not been attuned to that.
We're just tougher. We're just tougher. That just
Genetically
say it.
tougher.
It's all good. It's all good. Okay, I think we have some before and afters
Yeah.
of Albert. Unfortunately, he couldn't be here today. He had a personal emergency.
So he was looking a little droopy, a little angry. Still looked good for his age, but guys very much about a tight jawline. They want to look, good in the boardroom and good in the bedroom, and three or four.
Yes.
And
there's nothing wrong with that. I like it.
And so 3 or 4 chins generally bothers a guy. They want that Newt Rockney, Clint Eastwood type of jaw.
John Hamm.
Right. And so he just had a little smart lipo of his jawline to improve his jawline. Nothing severe. Something done under local anesthesia.
Yeah, no, we saw he was totally awake through the whole thing, and you were chatting with him.
And he was a bit
couldn't believe
angry
it.
looking. He looked malevolent. His forehead was dangerous looking, and he's a friendly guy.
Sorry, when you say recovery, back to work when?
Oh, he was back to work within 2-3 days.
Okay.
Yeah.
Okay, so did he have to wear that brace around
Over
his
the
head
weekend.
for long?
So a lot of guys do this on a Thursday night or Friday morning, back on a Monday.
Wow.
That's very common. Yeah.
Okay, and is he happy with the results?
I think he's very happy. When I saw him about a month after, he said it's really changed his disposition. He didn't, he's in a job where he has to sell himself, and he's looking angry and sort of dangerous. And so it's given him a stronger jaw, but a more approachable looking brow, because guys often look very frowny and dangerous. And if you're a lawyer or a judge, that's great. But if you're a sales guy, that's not.
No,
a
you want to
thing.
be Mr. Friendly. Yeah,
Right.
his kids weren't scared of him, which is nice.
Right.
That's that's good. You said a little bit of bruising, and was he in a lot of pain? Like,
No,
you have to
this
take
is
painkillers, anything like
No,
that?
a lot of people think about lipo and they think they've all seen some episode of Nip Tuck where there's this crazy thing going very aggressively
Well,
at
you brought the
I
little
did.
teeny tiny
Yeah.
in, didn't you?
Yeah, this is the would be the Smart Lipo Probe. It's a little laser filament about 600 microns, and that little filament goes very gently back and forth in the fat, and it melts. You think of a chunk of butter. It melts the butter, and then taking out that melted butter is much simpler.
So you
than
just put
trying
a little
to
suction in there and take it all
exactly,
out.
rather than trying to extract the whole block.
Which is what was done historically, correct?
Historically, liposuction was mechanically breaking up the fat, removing it. Now we do a 2-stage process. We use an energy system like Smart Lipo laser to melt it, and then the extraction is really easy. That means almost no pain, bruising, or downtime.
All right, we have lots more to talk about with male plastic cosmetic surgery when we come back. Stay with us. Welcome back to Doctor in the House. It's not just women heading under the knife for the beauty anymore. Cosmetic plastic surgeon Dr. Stephen Mulholland is back with more on what men are looking to change. So when they come into your office, what are the most common things men want to change about themselves?
11 years ago when I started, I saw one guy the entire year. Last year, I did about 130 little facial lift procedures. 30 of them were in men.
Really?
Shows you the huge transition in the practice. What do they come in for? Guys come in because they lose their maleness. So a strong chin. They come in for little neck lifts and
Right.
smart lipos like Albert. Or
You said to me like a 5-minute nose job? What's that?
Yeah, okay, so they come in
We have a
for
picture.
bags under the eyes or a nose that's starting to fall or it's too droopy.
Like this guy.
Like this gentleman. He doesn't want to do a nose job, but we can, through some of the injectable products like Reston or Perlane, in 5 minutes, I can give him a stronger nose.
Seriously, that's pretty good.
Yeah, that's a very popular procedure for guys that find when they smile, their tip is touching their upper lip. With age, it starts
Was he awake for that?
He was awake. That's under local anesthesia.
Local anesthesia.
Everything you're going to see today, in fact, can be done under local anesthesia.
Okay, what about eyelids? Is the next
Eyelids
one.
very common. You look droopy, you look tired,
Yeah.
and he just looks alive, a little more awake, and a very simple thing to do, upper and lower lids for guys.
I never knew that lids was also lower. I always thought it was just up there.
Very common. Guys will come with bags, and they're supposed to look alert and active in the boardroom, but they look tired, even if they've had a great sleep. Lower lid bags, very common.
The Perlin and the Restylane, permanent? Not permanent.
I don't like to do permanents because the face changes, especially a guy's nose. So an injectable like Reston or Perlane for a 5-minute nose job will last about a year. So guys come in once a year and get touched up.
What about neck lift is the next one?
Neck lift's very common. Again, if it's loose skin and not fat like Albert, a little pull on the loose skin gives you that tight Clint Eastwood, I'm an aggressive, make a decision alpha male look to the jawline, and that's what guys are looking for.
Yeah, that does look better. And finally, love handles.
Yeah, so
the age-old love handle.
The 50-year-old male breast and the love handle, very common. You can diet and exercise all you want. You can't focally lose it. So this is this is equivalent to our woman's outer thigh. Hard to lose that. And so love handle lipo, especially a smart lipo, where a guy can do it under local. There's no risk of anesthetic death. And they can walk out, so you see a doc, back to work on Monday, do it on a Friday.
Because that looked really good. That before and after was just terrific. When you talk to them, obviously you have a chat with them before you do the procedures to find out exactly why they're doing it. Why are men doing it as opposed to women? I mean, I know women, the panic sets in at about 40 and they're not looking as young as they used to, so they like to go, get a little nip tuck.
I have seen over the last decade a real transformation. I think it's multifactorial. Number one, men are doing it because we're more subject to cultural perceptions of beauty and attractiveness.
Right.
Men are out of relationships and divorced in greater and greater numbers, and they tend to be dating and snacking in younger snack brackets, and they want to look fit to match their younger partners, and they're doing it for the boardroom, so the bedroom and the boardroom. In the boardroom, they've got all these young guys coming up with their MBAs, and they want to look definitive and authoritative. And if you're looking tired and saggy and droopy, that might translate into maybe the old man's losing it type of attitude, and they want to be strong, youthful presidents in the boardroom as well.
So, and going to the gym sometimes just doesn't crack it.
Yeah, sometimes it makes you worse. You lose a little weight, your skin tone falls, and then you look toned but saggy. You look like that old guy in Santa Monica or down at the lakeshore, walking with his shorts up to his chest. So.
Okay, just real quick, what should people be aware of if they're thinking about getting some sort of cosmetic surgery?
Make sure you do your homework. The risks are real, and you want to make sure you have a real surgeon doing surgery. Make sure you've got a certified facility, and make sure that you've had some discussion with your physician on the nature of risk, because there is risk, and anyone who's not talking about risk is trying to sell you a procedure, then educate you in a process.
Okay. Thanks so much for being here. It's always nice to see you.
Nice
I'll be talking to you after the show. You know what I mean?